Hi, my name is Amy Joyce, and I'm the Director of the Office of Childcare within the Early Learning Division of the Department of Education. On August 14th, we issued new guidance for operating childcare and other early education programs during COVID times. We're doing a series of videos to help you understand and implement the new guidance. Please start by watching the introduction video from ELD Director Miriam Calderon. The introduction video describes the purposes of the guidance and the process we use to develop it. Then, watch the overview video. The overview describes who the guidance applies to and the process you need to follow to legally operate. For example, we continue to operate under the Emergency Childcare or ECC system, requiring licensed childcare providers and others to apply and be approved to operate as an ECC. This video covers personal protective equipment for children and adults. It's section 6 of the new guidance, and you'll find it on page 32. The focus of the section is protecting children and adults from exposure to COVID-19 by using face coverings, primarily cloth face coverings and plastic face shields. Some of this information in the video will overlap with other sections, like drop-off and pickup, daily health check, and family engagement. We'll have videos on each of those, so be sure to watch all of them for details. Here's the overview of this section, starting with face coverings for adults. All adults, staff, contractors, other service providers, visitors, and volunteers in the childcare must wear a face shield or a face covering. In a registered family or certified family home, this only applies in the childcare section of the home during childcare hours. There is a limited exception for providers and staff. If you have a medical condition or a disability that prevents the wearing of a face covering or face shield, you're exempt. The person claiming the exemption will need a note from a medical professional, and the note must be specific about face coverings. Next is face coverings for children. All children in grades kindergarten and up in the childcare must wear a face shield or face covering. Again, in an RF or CF home, this applies only in the childcare portion of the home and during childcare hours. Children with a medical condition, making it difficult for them to breathe, children who have a disability that prevents them from wearing a face covering, and children who are unable to remove a face shield or covering without assistance are also exempt. The parent must have a note from a medical provider specific to face coverings. If a child removes their face covering or they make it clear they need to take it off, remember this: supervise the child to try to maintain 6 feet physical distancing from everyone while the face covering is off. If needed, the child should be shown how to wear the face covering and guided to put back on that face shield or face covering. If a parent requests, providers must allow children between the ages of 2 and kindergarten to wear a face covering or face shield. The child has to be able to remove it without assistance. No child should ever be disciplined for an inability to safely wear a face shield or a face covering. And please remember, do not allow any child under the age of 2 or any child while they are sleeping to wear a face covering. It's simply not safe. When outside, if 6 feet of physical distancing cannot be maintained, face coverings or face shields must be worn by adults and children who are kindergarten age and up. Now let's talk about how to safely use a face covering or a face shield. Wash hands or use hand sanitizer before putting on the face shield or face covering, after taking it off, and anytime it's touched. This is true for both adults and kids. Wash face coverings or get a new face covering every day. For reusable face shields, wipe them down with disinfectant at the end of the day. Disposable face coverings or face shields can only be worn one time. Now let's move to outer layers of clothing. In order to prevent exposure, there are some times when adults need to protect themselves with an outer layer of clothing or a covering. First, what do we mean by an outer layer of clothing or a covering? You could have an oversized long sleeve shirt, a smock, or an apron, or even a sheet. as long as it's clean and it's covering the upper part of your body. You want to keep that virus off of you and not drag it around the childcare with you. Next, who wears it and in what situations? Any adult who interacts with multiple stable groups needs it when moving to a new group. An adult feeding infants also needs to wear that outer layer. If that child is in your arms being fed, you need an extra layer to protect you. And also remember, if you have long hair, please tie it back. Anytime you get bodily fluids on your clothes, that outer layer must be changed. When someone at the childcare is having COVID symptoms but hasn't yet been able to leave, any staff providing care and monitoring needs to keep 6-foot physical distancing and be absolutely sure you are properly wearing your face shield or face covering. In this situation, we recommend a medical grade face mask for extra protection. Now let's focus on using PPE during a specific part of the childcare day, the daily health check. Again, watch the video on the daily health check for complete information on that process. If there was any interaction with a sick child during the daily health check, change your face covering or sanitize your face shield before continuing work. And if you're in a certified center or a recorded program, sanitize face shields after all the health checks are completed. And the adults who complete these daily health checks need to wear that clean outer layer. That's it. Now, we expect you may already have questions. We're trying to anticipate those and provide answers. So, question: do the residents of a registered family or certified family home need to wear a face covering? The answer: only in the childcare portion of the home and during childcare hours. If you have questions, please email them to providercontact@state.or.us. That's providercontact@state.or.us. We have an FAQ section on our website, and we'll continually update that with your questions and our answers. Finally, what resources or supports will the ELD and Office of Child Care be providing? OCC will be creating a summary document that providers may choose to give to parents. We're creating a template sign to alert parents to the face covering requirement. And we are working to acquire supplies, facial coverings, as well as gloves and cleaning supplies, so you can have access to what you need at a discounted price. More to follow on that later. If you have ideas for other resources, please send them to the provider email address and we will consider them. Thanks for watching, and thank you for providing nurturing care and education to Oregon's children and this crucial resource for Oregon's working families.